I'm going to show the kinesthetic learning style by the protective placement equipment through touch and feel and practice, and the auditory learning through lecture, demonstration, and discussion on hand washing. The behavior domains will be with the cognitive, with the test at the end, and the psychomotor with the return demonstration of the hand washing at the end. Hello, my name is Karen Mullenbeck, and I'm going to be your instructor for this afternoon. We're going to be talking about asepsis and standard precautions and what they are, and blood-borne pathogen procedures. Recently there was an informal telephone poll given, and they asked people about washing their hands, how many washed their hands into the bathroom. And 90% said they washed their hands. Well, then they went to the public bathroom and checked, and only 82% of the people washed their hands. That's a big difference. How many of you wash your hands after you pet your dog or your cat? Public transportation, do you ever wash your hands? Handling money, preparing food, shaking hands with people. We all have different ideas on how we wash our hands and when we wash our hands. That's through training and education. But I think we all agree that we should wash our hands when we go to the bathroom. I have two handouts here for you. One is a hand washing checklist, and the other is a standard precautions checklist, the key components of standard precautions. We'll start, as you see at the top of the list, is hand washing. In standard precautions, we have to treat all human body fluids as if they are infected with a germ or pathogen. A pathogen can cause disease. So bacteria or virus that can cause disease is a pathogen. And that's in blood, urine, sputum, all body fluids except sweat. They don't feel that that has any disease potential. So the top thing on the list is hand washing. So now I'm going to go over, and if you'll come with me, and I'll show you the proper hand washing technique. First you turn on the water, you get a warm stream of water, and then you put on soap, and you lather up good, and you wash between your fingers, and then you wash between your fingers from the top on both hands. This whole procedure is supposed to take 15 to 20 seconds. Maybe it's like singing Happy Birthday twice through. Then you have to wash your thumbs. Make sure you get a good thumb hand washing. Wash your thumbs. And then you have to rub between in your palms. Then when you start to rinse, have the water run from your wrists, down your fingers, and down the drain. Always keep your hands down. And then when you're done, get a paper towel, wash your hands, dry them thoroughly. Make sure they're good and dry. And then use your towel to turn off the water without getting your hands back on the dirty faucet. Okay, now we'll go back. On our list, the next thing after hand washing on our list is to keep germs from spreading. That's your job as a healthcare provider. Your job is to keep germs from spreading. That's the asepsis part of the demonstration, is to keep germs from spreading from you to your patient, from your patient to you, or from patient to patient. You could do that if you're not careful. So the gloves are for one-time use only. They come in various sizes. They're small, medium, and large. So they'll fit fairly well. It don't have to be a tight fit. But you put them on, and then you do your procedure with your patient. You give them a bath or empty the bedpan or whatever it is that you do. And then you get your, okay, put your gloves on, do your procedure, and then before you go to another patient or do something else, when you're done with that patient, you take them off, inside out preferably, and throw them in the trash. And then you go and wash your hands. Make sure you wash your hands. Even though you have gloves on, there could be a small pin prick or something in the glove that keeps them from protecting your hands fully. The next thing we have are masks and goggles and face shields. This is a face shield that fits around your head. There'll be various models of those available, or goggles. They'll fit over your glasses if you wear glasses. If you don't wear glasses, use the goggles. And here's the face mask. It'll fit over your head, and that is to protect your eyes, your nose, your mouth from germs that might likely get in. Then we have a gown. This is a blue plastic disposable gown. You slip it over your head and in the sleeves. If you think there's likely to be a large amount of blood or body fluid spilled, you want to protect your skin and your clothing. And throw this away in the garbage when you're done with it. None of these items are reusable except maybe the goggles. But everything else is one-time use only. The linen, when you're changing a bed for a patient, make sure you fold the linen in toward the center quietly. Don't fling it around. You want to disturb the air and any possible germs that would be there from getting into the air and getting someone infected. Then patient care equipment. That would be equipment like wheelchairs, walkers, braces. That all has to be cleaned on a regular basis, and I'm sure there will be a procedure set up where you're working that will explain what that is. There's environmental cleaning, where you have to clean the room. You clean everything in the room. The floors have to be mopped, the beds have to be wiped off, the bedside tables have to be cleaned on a regular basis. There's sharps. These are anything that could puncture your skin, such as a hypodermic needle or a razor blade. And these sharps containers are a box or some sort of a hard plastic that you cannot puncture. And it has a top that you open and drop your sharp in, and then it closes. And then at periodic times they are emptied. And if you have any CPR equipment, if you ever do CPR where you're working, that equipment would either have to be disinfected or thrown away. Also, the other kind is patient placement. If there's a person that can't take care of themselves properly, clean themselves, you might have to put that person in a room by themselves so that they could not infect somebody else. We're going to discuss now bloodborne pathogens. Again, any patient fluid, any body fluid is considered infectious when you're working with patients. So a bloodborne pathogen is a virus or a bacteria that's in your blood that can cause infection. And it's such as hepatitis B or AIDS, HIV, or 100 others. The CDC has classified 100 diseases as infectious in the world. These bloodborne pathogens are classified as to how they're transmitted, and that's how the isolation is done. It's airborne. They're transmitted through the air, a bacteria or a virus. They get into the patient's lungs and they're exhaled into the air. So you have to be sure you wear a mask when you're in the room and protect yourself from any possible, and any visitor that comes into the room would have to wear the mask also. You'd also want to wear gloves because you never know what you would be touching in that room that could cause you to become ill. And so, and there's negative pressure in the room that causes the air to come in and instead of out into the unit. So the negative pressure comes into the room. There's airborne, and then the next one is droplet infection. That is when the patient would cough or sneeze, and the infection would be in the droplets that come out of their mouth. You would certainly wear a mask, a face shield, or goggles if you're working closely with the patient, and gloves and a gown if necessary. The third type of isolation is contact. That is just with touching. So if they would have an infection on their skin, why, you would be sure and not touch it, only with gloves, and make sure you wash your hands. So there's 3 ways that diseases can be spread. Do you remember what they are? Yes. There's airborne, droplet, and contact. And it's through your skin. If there's a puncture in the skin with contact, it could get in your lungs if you aren't properly protected, through your mucous membranes, which are in your nose, and your mouth, and your eye, and on your skin, and then in the air. So proper hand washing is always necessary. You can never go wrong. Wherever you are, before and after touching a patient, please make sure you wash your hands. This is the #1 way that disease is spread. And remember, all body fluids, including urine, urine, mucus, coughing, and feces, and tears even, that's all considered potentially hazardous and can cause disease. So wash your hands, wash your hands, wash your hands. Any questions? Okay, thank you. How long was that?
Wait and stop.